Hi guys, welcome back to my channel. My name is Ziad, Crohn's disease patient, NHS worker and educator, here bringing you IBD facts and taboo breaking chats. Don't forget to like, comment, share and subscribe on my channel. So let's get started. Hello and welcome to this lesson on inflammatory bowel disease versus irritable bowel syndrome. So many of you have heard the terms IBD and IBS being interchanged for one another as if they were the same thing. While it is true that both present with similar symptoms and can be triggered by similar things, they are, however, not the same. IBD is classified as an actual disease that causes intestinal destruction due to the inflammation, while IBS is defined as a syndrome or a disorder of gut function brought about by the control of the gut-brain axis. Furthermore, the differences don't stop there, as you can see IBD when diagnostic imaging such as X-ray, CT, MRI and ultrasound scans are used, whereas you can't see IBS on these scans, and IBD is associated with an increased risk of developing colon cancer, whereas IBS is not. Even though symptoms of IBS such as bloating, abdominal pain, diarrhea and constipation are similar to IBD, there are so many other features that separate the two. For example, IBD is associated with fatigue, weight loss, generally feeling unwell, loss of appetite, as well as mouth ulcers, whereas none of these are present in IBS. The most obvious difference between the two is that the inflammation in IBS does not cause destructive damage to the intestines. In addition to, there is no bleeding after bowel movements in IBS, unlike IBD, further differentiating the two. So then this does bring into question as how IBS symptoms are able to occur and why they are so similar to IBD. This isn't a simple answer as such, however it is important to understand how the gut-brain axis works. The nervous system is made up of about 100 billion cells called neurons, which transfer signals received from within the body or the outside environment to the brain and back to the body again, which allows the brain to control processes such as our breathing and helps us respond to things that can cause us pain. Now, the nervous system can be split into the central nervous system, which is made up of the brain and spinal cord, which are protected by the skull and the spine. The peripheral nervous system, which consists of all other neurons in the body, which are not contained in the skull and the spine. And this is an oversimplification of the nervous system, as some elements of the peripheral nervous system can be found within the cranial and vertebral cavities. Now, the peripheral nervous system is further subdivided into the somatic nervous system, autonomic nervous system, and the enteric nervous system. So both the somatic and autonomic nervous systems have sensory and motor subdivisions. These are known as afferent and efferent divisions. So the afferent divisions include sensory neurons that can detect stimuli from the external environment such as temperature and can carry electrical impulses to the central nervous system. The efferent divisions include motor neurons which carry impulses away from the central nervous system to bring about a specific action to a muscle or gland. To further simplify these subdivisions, the somatic nervous system has afferent divisions which link sensory receptors of the body to relevant processing circuits, and its efferent divisions directly control skeletal muscles via the use of motor neurons. And the autonomic nervous system, the afferent divisions link sensory receptors that monitor blood pressure, carbon dioxide and oxygen levels, as well as chemical compositions of the gut. Whereas the efferent division, which is further subdivided into the parasympathetic and sympathetic divisions, which control muscle and glands which are involved in the fight or flight response. And it is this response which is thought to be involved in IBS. So the fight or flight response is an acute physiological change that is brought about by a threat that will allow the body to react to that threat, either by staying to fight it or by running away from it. So these threats cause the sympathetic nervous system to increase your heart rate, breathing rate and blood pressure to increase the supply of blood, oxygen and hormones to our brains and carry muscles to carry out a response. This causes a decrease in the activities of non-essential systems or processes such as digestion and the immune system to deliver more energy to the components that are going to allow you to either fight the threat or run away from it. When the threat is over, the parasympathetic nervous system can take over to return the body to its normal state by counteracting the effects of the sympathetic nervous system. These threats trigger IBS symptoms due to the communication between the central nervous system, autonomic nervous system, and enteric nervous system being influenced by the hypothalamic pituitary adrenal axis, bringing about dysbiosis to the gut microbiota. So the HPA has three components: the hypothalamus, pituitary, and adrenal glands. It is the primary stress efferent axis of the body which manages an individual's adaptive reactions to environmental stimuli using cortisol, which is a stress hormone that influences bodily functions. Now, it's thought that the HPA is able to bring about IBS symptoms through the individual being exposed to an external factor that induces stress and anxiety. This causes mast cell degranulation to cause a rise in systemic pro-inflammatory cytokines within the body. This then causes the hypothalamus to release corticotropin-releasing factor and activate the HPA axis. Corticotropin-releasing factor, or CRF, stimulates the anterior portion of the pituitary gland to release adrenocorticotropic hormone, or ACTH. This ACTH causes the release of cortisol from the adrenal glands, which are located just above your kidneys. Cortisol then triggers both neural and hormonal communication to occur to the brain. This then influences the functioning of effector cells in the intestine, which include immune, enteric, and muscle cells, which are also influenced by the gut microbiota. This then causes the permeability of the gut to change, disturbing the homeostasis of the gut, causing more substances to enter the gut, causing dysbiosis and bringing on the onset of IBS symptoms. And it should be noted that if you do have IBD, you can also suffer with IBS as well. So to summarize, we've gone over the difference between IBD and IBS. We've looked at the branches of the nervous system and how IBS symptoms are triggered in the body.